Thank you, ladies and gentlemen. My name is Dr. Thavatchai. I'm from Rajabhat University in Sunsudanta. Now I'm acting head of the cannabis health science section. Before I retire, I was working in the field of the administration for the Director General of the Cannabis Health Science. I am also a surgeon, same as Christopher, and I have been working for surgery in more than 30 years until now. Today I would like to present the direction and policy of the medical and traditional wellness in Thailand. Next slide, please. Yes, as you know that we are facing a chronic disease. That's why we call them chronic disease, because they are incurable, and it causes a high number of deaths in Thailand, especially in cancer. Cancer is the #1 cause of death now, but we try every way to live longer and trying to get rid of the chronic disease. But in the field of the modern medicine, we are facing many problems. But so I'm interested in the part of the integrated medicine. Next slide, please. Do you have like a remote control for me? No? Oh. Can you move this slide? Next, please. Next. Yeah, I finished this one. Next. Next. Yeah. Okay. We all know that we are moving to the aging society. And now we are in the complete age society already. So more than 20% of the people in Thailand already in aging age. And in the future, in the next 20 years, we will be in the super age society. Next slide, please. Next slide, please. Yeah. In the meanings of the traditional medicine, it's the way that we use our wisdom that has been using for more than 1,000 years and saved our lives until now. And the traditional medicine in Thailand, we are trying to promote overall wellness and balancing the homeostatic system in our body by using all kind of methods like herb, cannabis, massage, yoga, and many others. And as a part of the policy maker, I was once working as a policy maker. Next slide, please. And this, you will see the whole system of the medicine in Thailand. Not only the Western medicine that we have, we also have the alternative way to treat the patients. And also we have a Thai and Chinese traditional medicine to do the method like herbal medicine, not Thai or Thai massage, and also midwifery and child care. Next slide, please. This is the policy of the WHO, World Health Organization, that trying to set the traditional medicine into the normal system that we have in every country and make it more standard. Next slide, please. So as a policy maker, I was promote them to put the name of the traditional medicine into the Constitution of Thailand. So every ministry and every part of the country moving forward to improve Thai traditional medicine for the maximum benefit. Next slide, please. And before the COVID, we have like a committee to do the healthcare reform, and we passed the bill about the herbal products bill because we found that many herbs cannot place into medicine because they have no enough evidence and they are not cosmetic. So we passed a new law called the herbal medicine. So now we can prescribe herb as a medicine for the patients. Next slide, please. And in activities to promote the strengthening of the traditional medicine and alternative medicine healthcare to healthcare system. Next slide, please. Compared to other countries, Thailand has like advantage on we know our hospitality or the service mind that everyone who do in the health worker, we're trying to teach them to do the hospitality. And also we have another advantage is that about the cost. The cost of the wellness and healthcare in Thailand is quite reasonable, and compared to other countries, we can access more easier. Next slide, please. In order to promote the use of the Thai traditional medicine and develop the medical hub in Thailand, there are 4 fields that we have to do, not only in the part of the medical care, but in the part of the wellness care and also the academic regions is important. Next slide, please. And this we prepare for the visitor that to stay in Thailand longer than normal to get the special kind of visa. And also we promote the hospital and clinics to do elderly care and chronic care. And now in Thailand, I think we are ready to, and for this infrastructure we have already done until now. Thank you. Next slide, please. Yeah, for the service and wellness hub strategy, in order to retard the aging process, to keep themselves homeostatic state, into the balance in mental, physical, spiritual health, with a long history of Thai traditional method. Yeah. Next slide. Massage is the one. Thai massage is the famous, and everyone, I think you know that is good for relaxation and reduce the anxiety. Next slide. The government put the policy to set up the Thai traditional clinics plus the cannabis clinic into every hospital in Thailand in order to promote the use of herb, and people can access easily, not only in the hospital but in the health station. And we expect to have about 20% of the whole medical method. Next slide, please. about the wellness hub, I think our infrastructure, we have so many places that are good for the visitor to make a choice if they want to come to Thailand, and you can find in internet. And also, yoga is a very good one. We have in all the fitness center in Bangkok also. Next slide, please. The way of service that we give with patients in order, not only the conventional method, but the alternative way is meditation, herbal treatment, natural therapy, food therapy, and for the oxygen therapy. Next slide, please. And one thing that I think we are famous in food for medicine also in Thailand. I think food is good to prevent kind of many chronic disease. And those, next slide please, are so delicious and healthy. I'm sorry to make you hungry because this is Thai food that you should try one when you are in Thailand. Next slide, please. Cannabis is another one that now in Thailand we have like more. We do a lot of things, research, and we have the clinics and treatment in Thailand in every, almost in every hospital now, in every regions. But we call the happiness medicine because when you exercise, what we found is that the endorphin and adrenaline also increase in blood level. So it also makes people happy. Next slide, please. Next slide. Okay. So the cannabis has many wellness benefits for like pain, depression, also good for glaucoma, weight loss, Parkinson, Alzheimer, and many other diseases that has been promoted and researched. Next slide, please. Yeah, cannabis can reduce inflammation, reduce pain, and promote the hunger for the anorexia patients. So in the case of cancer, with the chemotherapy, they reduce the side effect of the chemotherapy. So we have indication for medical use in Thailand also. Now, next slide. Okay. And for the second area is about the herbal products. The herb is important, and we need the standard, high standard with safe and efficacy use. So we need to do more on the research and trying to promote them to produce in the GMP standard, especially the GMP PICS standard. Next slide, please. And for the effect of the cannabis on cosmetic, it can reduce wrinkle. If you use it, you know, the CBD cream, CBD oil at night, your face will be like more beautiful. Yeah. Next slide. And for the aromatherapy, aromatherapy we also have available in every spa and massage place in Thailand. Next slide. Yeah. On the marketing side, we have online marketing as well. Like 2 weeks ago, we working together with the Ministry of the Commerce to promote the use of the application that any people everywhere in the world can access, and they can have a choice for wellness and medical care when they come to Thailand. Next slide. On the last part, academic side, I think this is important because as a Director General, I found that we have not enough the researcher, and the one most of doctors have know little about the cannabis and herb, so they are not using them enough. So we set up the program on the cannabis health science, and we have like about 200 students already graduated from us as a bachelor degree. And now we are moving to the master and PhD program this year. Next slide, please. So anyone, if interested in this program, can apply and join us and be a part of cannabis health science and herbal medicine. Next slide, please. Next slide. Okay. So it's almost opening now. With next slide. Yeah. In conclusion, I think the in wellness care, not only in part of the massage, herbal medicine, integrative medicine, we also supply the cannabis medicine for all visitors to come and study in Thailand also. Thank you very much. We already have products like. May I ask me again? What is the name of the psychedelics?
Because now it's proven. Okay, thanks. Okay, so there is something that is called psychedelic medicine, which includes application of the LSD, microdosing of psilocybin, and other stuff, DMT, that is psychoactive, that can assist psychological work, or it can literally cure, for example, certain mental conditions. There is also very very famous drug, which is called ibogaine, which can literally remove dependency after 30 years of opium or cocaine or whatever in literally 24 hours. So is there any consideration of the Thai government to go in that direction? Thank you.
At the moment, we are not having that topic yet, but I believe that if in the future, I think if the standard medicine import to Thailand, the modern medicine will learn how to use it, and it might help the patients with the addict. Yeah.
I mean, ibogaine is not regulated in Thailand. It's already,
no, not yet.
Yeah, it's already used in some centers. It's a sensitive question, but it really works. And how to say, there is also a traditional medicine in Thailand, for example, something that people like to call in the entertainment industry magic mushrooms, but it's actually very potent psychedelic drug, which contains psilocybin as a main ingredient, which can be really successfully used for the many conditions, from PTSD, OCD, clinical depression, and so on. Even dementia can be treated successfully.
Yeah.
So I really hope it will come, because they said that one of the best mushrooms in the world are Thai mushrooms.
Yeah, thank you for your suggestion.
Thank you.
Thank you. Oh, yeah.
Ajahn Krab, thanks for your presentation. I have a really quick question. I'm quite interested in medical cannabis as well, but let's say you are producing extracts, right? And this particular batch or this particular lot has happened to have some sort of an impurity causing some allergies to the patients. How do you then suggest that we can actually trace back, the entire batch, or is there some sort of a framework which has been laid out regarding traceability and medicinal cannabis?
Right now, we grow our own one in lab in the closed system. So
Indoor, right?
Indoor, yes. So it will be purified, and we have a lab to extract and prepare only for the research. But in Thailand, we supply the cannabis oil from the GPO, the Government Pharmaceutical Organization, and it's very high standard. That what we prescribe for the patients. But for the one that we prepare ourselves, we use it only for the research. But in the future, I think maybe we will prescribe and make it national standard also. And now we are moving to that way, yeah.
So assuming that if something goes wrong and a patient reports that this particular, let's say, cannabis extract is causing some allergies to them, as a producer, you should be able or would be able to trace back, right, from which products has been produced on that lot.
Yes, of course. I think now FDA, if we are producing that kind of products, in that case, I think if the cannabis product will, they have to register to the FDA in many other ways, like for the medicine, for the herb, and it depends on what kind of products. But the problem now is that when they grow the cannabis, they prescribe as the personal care for each patient, and those doctors have to be responsible for the cost. Yeah.
Okay, thanks, Thavatchai.
Thank you. Any other question? I think everyone hungry already. Especially seeing my food, my Thai food. Yeah. Thank you very much.